Pancreas is dying. 12 weird signs of pancreatic cancer. Pancreatic cancer is one of the most common types of cancer and is in fact the one with the highest mortality rate of all major cancers. The relative survival rate of pancreatic cancer is just 12% in the United States within 5 years. This occurs because pancreatic cancer hides silently over months to years, progressively infiltrating various tissues without showing initial signs. If you found this information helpful, I kindly ask that you take just a moment to like the video, subscribe to my channel, and also share it with others. In addition, when it finally starts showing some signs, most people ignore them until later stages when the cancer has spread from the pancreas to other organs and can no longer be removed with surgery. Also, if the cancer is actually detected at an early stage, the 5-year relative survival rate jumps to 44% from 12% when detected later. In this video, where we will explore 12 odd symptoms of pancreatic cancer to watch for and act on quickly before irreparable damage occurs. The pancreas performs absolutely vital functions like regulating blood sugar through insulin production while also supplying digestive enzymes to break down the food we take in. This is essential so we are able to use the nutrients for energy production, fueling all activities in all tissues and organs throughout the body. The prevalent belief that pancreatic cancer only strikes older adults with risk factors like smoking or those with a family history is somewhat misguided. In reality, influences like genetics, toxins, and even being obese or being tall can all lead to or increase the chances of these tumors initially developing. If you want to check for pancreatic cancer, stick around and watch this video all the way to the end. We will also discuss some simple home remedies to slow down or reverse tumor growth. First symptom, jaundice. One potential early sign of pancreatic cancer to watch out for is the yellowing of the skin and eyes, known medically as jaundice. This jaundice occurs when bilirubin, a yellow B pigment, builds up in the blood. This bilirubin is a normal byproduct when old red blood cells break down. The liver normally filters out bilirubin, where it passes through the bile duct to the intestines and exits the body harmlessly in stool. However, when pancreatic cancer occurs, tumors often grow in the head of the pancreas, which is near the bile ducts, causing obstruction. This blockage prevents bilirubin from reaching the intestines for removal. Instead, bilirubin accumulates to high levels in the blood, then seeps into skin and the eyes, which then appear yellowish. The more advanced the blockage, the darker and more widespread the yellow color becomes. So keep an eye out for any new onset or spreading yellowish skin or eye changes. Another potential sign of pancreatic cancer is unexpected, rapid weight loss without clear explanation. As pancreatic tumors grow, they take calories and nutrients away from healthy tissues by burning excessive calories, which manifests as quick loss of weight. Since the pancreas also supplies enzymes critical to properly break down fats, carbohydrates, and proteins from food, tumors hinder secretion of these digestive enzymes, leading to improper digestion and nutrient absorption, also accelerating weight loss. While gradual small weight fluctuations are normal in most people, rapid and significant loss of total body weight warrants medical evaluation, especially if not clearly linked to changes in diet or exercise. Next symptom, sudden loss of appetite. Loss of appetite or feeling excessively full after eating small amounts, known as early satiety, can also indicate pancreatic cancer. As tumors grow within the pancreas, they often compress surrounding organs like the stomach and intestine involved in digesting food and regulating appetite. Important nerves and hormones that come from the intestines, stomach, and pancreas itself get obstructed by the cancer mass, leading to the suppression of hunger and appetite. In addition, the cancer cells also release chemical substances that further suppress hunger. The tumors also take away calories and nutrients that should be used by the normal body cells. Due to the combination of all these different mechanisms, the desire for food is reduced significantly and adequate food intake is limited. This can then further contribute to weight loss discussed earlier. Sign number 4, light-colored stools. If you notice an unusually light-colored or pale brown stool, it can also indicate pancreatic cancer. Healthy stool features a normal brown color which comes from bilirubin, a waste pigment secreted into bile. However, when pancreatic tumors obstruct bile drainage as explained earlier, bilirubin cannot reach the intestines properly to eliminate in stool. Without bilirubin, stools lose the typical brown color. Instead, they become abnormally pale. So, while temporary stool color changes can result from certain foods, consistent pale stools warrant evaluation for underlying medical conditions, especially alongside jaundice symptoms. Dark urine is another sign of pancreatic cancer. As discussed earlier, tumors obstructing bile drainage cause bilirubin accumulation in the blood. While some seeps into skin and eyes, causing yellowing, excess also spills into urine, giving it a darker tone. As blood bilirubin levels continue rising from bile blockages, urine color goes from light yellow to amber, brown, and eventually very dark colors. While temporary concentrated dark urine can result from dehydration, persistent discoloration warrants medical testing. Next symptom, itchy skin. High levels of bilirubin crystals depositing under the skin due to pancreatic tumors can also lead to significant itching sensations without visible rash. The itching typically starts on the palms of the hands and soles of the feet, which are very sensitive areas. However, it can spread everywhere as extreme bilirubin elevation allows crystals to sprinkle across bodily membranes. The eyes may also itch and water significantly. While many factors can provoke mild temporary itching, severe unrelenting skin irritation warrants evaluation for underlying obstructive jaundice. Another sign of pancreatic cancer is abdominal pain. Important digestive processes like stomach emptying and intestinal food propulsion depend on coordinated muscular movements. However, as the pancreatic tumors expand, they compress nearby organs. Organs like the intestines and stomach, eliciting cramping pains as normal motility falters. Nerves transmitting signals also get entrapped, triggering sensations of severe discomfort. So, if you also notice severe, steady abdominal pains, especially with other symptoms, discuss it with your doctor to assess for underlying digestive organ compression. Next symptom of pancreatic cancer, unexplained back pain. The development of unexplained back pain can also signify potential pancreatic cancer. As pancreatic tumors expand, they may irritate or compress the network of nerves surrounding the organ. The pancreas lies closely along the spine behind the stomach. Key nerves exiting the spinal cord pass by the pancreas carrying signals to and from the brain. As cancers invade this space, they can entrap nerves eliciting sensations of back pain. Furthermore, tumors may erode through the rigid spine structures themselves, also igniting pain. While many factors can cause temporary back pain, unexplained persistent mid to upper spinal aches warrant medical evaluation. Symptom number 9, nausea and vomiting. As the tumors grow, they can also obstruct drainage from the stomach, liver, and pancreas itself, disrupting digestive processes. Bile flow blockage into the intestines also impairs nutrient absorption and gut function. These impedances lead to abdominal pain, toxicity buildup, and impaired gut movement, triggering profound nausea. Additionally, irritation and obstruction of the vagus nerve, which helps to synchronize digestive rhythms, provokes forceful reverse stomach contractions, attempting to vomit out the toxins, even when they are not actually there. Next symptom, new onset or diagnosis of diabetes. New development of diabetes can also signify underlying pancreatic cancer. The pancreas plays an integral role in regulating blood glucose levels by secreting insulin and glucagon hormones. While insulin lowers blood glucose level, glucagon helps to raise the levels of glucose. The secretion of these two hormones helps to maintain optimum sugar level as needed. However, as tumors arise within pancreatic tissues, secretion of these glucose-regulating hormones gets disrupted. As the cancer expands even more, insulin production fails completely, leading to high blood sugar, medically known as diabetes. As diabetes often gets diagnosed first, don't dismiss new onset of high blood sugars and consult your doctor as soon as possible. Fatigue is another possible sign of pancreatic issues. As the tumors grow, they drain all energy resources and deprive healthy tissues of nutrients needed to function properly. In addition, the tumors infiltrate and destroy oxygen-carrying red blood cells in the marrow and spleen. With fewer cells to collect oxygen vital for energy production, rapid muscle tiring sets in even with trivial tasks. Compound these with poor intake from appetite and digestion changes, and profound fatigue quickly sets in. Another sign of pancreatic cancer is blood clots. Tumors secrete a variety of growth signals and vascular substances that make blood abnormally sticky. This means red cells clump together, increasing viscosity, while also activating clotting mechanisms. As a result, small clots start forming throughout the blood vessels. If fragments of these clots break loose, they can travel to the lungs, obstructing circulation, causing shortness of breath. Vessel narrowing in the legs from clots can also manifest as calf pain with walking. If you notice one or more of these common early warning signs signaling pancreas trouble, don't panic, but do make prompt medical appointments. The good news is that applying certain lifestyle changes and medical intervention can help halt and lower the chance of developing pancreatic cancer. 1. Quit smoking and avoid secondhand smoke to prevent further DNA damage and inflammation. 2. Follow an anti-inflammatory diet high in fruits, vegetables, whole grains, and omega fats while minimizing processed red meats and excess alcohol to protect pancreas tissues. 3. Avoid or limit exposure to chemicals that may lead to the tumor in your workplace. 4. Increase physical activity daily to improve insulin sensitivity and stabilize blood glucose levels, thereby reducing diabetes risk. The key is early detection alongside healthy lifestyle choices for greatest odds, stopping pancreatic tumor progression and overcoming the disease. Stay vigilant and discuss all symptoms with your doctor at the first signs of trouble. I appreciate you taking the time to learn about the common, yet overlooked, signs of pancreatic cancer. If you found this information helpful, I kindly ask that you take just a moment to like the video, subscribe to my channel, and also share it with others. This allows me to continue producing more content focused on keeping you safe, healthy, and well informed. I look forward to seeing you in the next one. Take good care until next time.